name's Summer, and we're going to do a sinus series. I'm going to go get my patient. Miss Brooks.
Hello.
Hi. What's your first name?
Sabina.
And your birthday?
September 20th, 1991.
Perfect. And any chance of pregnancy for you?
No.
We're doing a sinus series, some sinus x-rays today. Have you ever had this done before?
No.
What's the reason we're doing this?
Had a lot of congestion lately.
And what doctor?
Dr. Book.
Dr. Blunt sent you in. Perfect. Okay. So first thing I'm going to have you do is I'm going to have you stand right over here with your chin, or I'm sorry, with your nose and your forehead against the board for me. Perfect. Just like that. I've got my Bucky at a 15-degree angle. My central ray is going to be horizontal. I have my left marker on the patient here. I'm going to shield her. And I'm just going to push this right here for you. Perfect. Okay. I'm doing this on an 8x10, and the central ray is going to exit the nasion. This is going to show the anterior ethmoid sinuses and the frontal sinuses. And I'm going to use a technique of about 70 at 10. And we always just want to make sure that the OML is going to be perpendicular with the IR. All right, next we're doing the parietal acanthial, also known as the Waters method. For this one, I'm going to have the patient put her nose and chin on the board, and this forms a 37-degree angle with the OML. I have the Bucky now vertical, perpendicular, it's just straight up and down, however you want to say that. I'm using my marker here, and I'm shielding. I'm gonna make sure that my central ray exits the acanthion, which is just right here. And on this, I'm going to use about 70 at 15, which is kind of a smaller wrinkle on the latter side. And this is also done on an 8x10. This is showing the maxillary sinuses. All right, next we're going to do a right lateral. This is what Dr. Blum ordered. For this one, I again have the patient shielded. I have my marker on the board. We're using an 8x10. I've collimated down a little. Sometimes you can use a cone on all of these sinus series. For this one, you're going to make sure that the interpupillary line is perpendicular. I'm just going to make some adjustments here. And then the central ray enters about ½ an inch to an inch out of the outer canthus with the IOML horizontal. And she's shielded. Oh, the technique for this one. It's about 70 at 8 mass. Alright, next is a kind of a tricky shot. We're doing the SMV, which is the submento vertical projection. It's also done on an 8x10. I'm going to have the patient put her head back. We're going to have the central ray enter 3/4 an inch anterior to the EAM. And for this, we're going to use about 75 at 12. Okay, so I'm going to have you put your head back. I'm just going to move you this way a little bit. Like I said, 3/4 of an inch above the EAM. And got my right marker there. She's shielded. And that's it. All right, the first image we're going to do, we're doing a mandible series now on our same patient. First image is our perpendicular central ray. It's going to be entering at the acanthion. Got my left marker here. We're using an 8x10. And I am all lined up. I'm going to shield her, of course. And then I'm going to use a technique of about 75 at 8. All right, X-ray. Next image we're going to do is our axio, PA, axial. I'm going to tilt this at 25 degrees and bring it down to line it up. Still using an 8x10 here, and I'm still centering at the acanthion. Still have my marker, still have her shielded, And for this one, we're gonna increase the technique just a little bit and do a 75 at 10. Just because you usually increase your distance a little bit. We're looking at the body and the ramus of the mandible. And after this, we're gonna keep our angle on our tube and we're gonna do an axiolateral. So I'm just gonna make sure that her interpupillary line is lined up. So I'm gonna just adjust you a little bit here. There we go. And I'm going to make sure that my technique's gonna be about 70 at 8 for this one. And my marker is just gonna be all the way over here. Okay. And I'm just gonna move you back just a little bit. Put your chin up a little. Put that straight. Perfect. That's right there. I'm gonna shoot that. And then after this, we're gonna do a little bit more of a difficult one. Have you face forward for me. Take this tilt off here. That's gonna line it up. You might want to close your eyes a little bit for me. Just hold that real still right there for a second. Okay. Now what I'm gonna have you do is lean your head back for me, just like that. I'm gonna have you take a little step forward. I'm gonna get the central ray right above the angle of the mandible on this one, and everything's included in there. The IOML is going to be parallel to the IR, and the central ray is going to be perpendicular to that same line. And we're going to do this at about 70 at 10. All right, you can relax your head, and that's it.
Thank you, Summer. You did a great job.
Okay, now we're gonna just evaluate our images and make sure we got everything we need. So for this PA axial sinus is the first one we did. We can see that we have proper collimation. There was use of a cone. There's equal distance between the lateral borders of the skull and the lateral border of the orbits. This indicates no rotations. The petrous ridges are symmetrical on both sides, and they lie in the lower third of the orbit. The frontal sinuses lie above the frontal nasal suture, and anterior ethmoid air cells laying above the petrous ridges. You also want to be able to clearly see air fluid levels. All right, this is our parietal acanthial sinuses, also known as the waters. On this one, again, there's proper collimation. We're using a cone. The petrous ridges lie immediately inferior to the floor of the maxillary sinus. There's equal distance between the lateral border of the skull and the lateral border of the orbit on both sides, indicating no rotation. And orbits and maxillary sinuses are symmetrical on each side. Also, this can indicate air fluid levels. We're now taking a look at our lateral sinuses. This is a great image because it shows all 4 of the sinuses. You're going to want to collimate down for these. The sphenoid sinus is really what's important here. The sella turcica is where you can tell if there's any rotation. You want to make sure that there is not. You also want to check for superimposed orbital roofs and mandibular rami. And then you just want to make sure that all the sinuses are visible and check the air fluid levels. This is now looking at our submento-vertical projection, also known as the SMV. You again want to make sure there's proper collimation. You've got equal distance from the lateral border of the skull to the mandibular condyles on both sides. That just tells you whether the mid-sagittal plane is perpendicular, so that there's no tilt. You want to also see that the anterior frontal bone is superimposed by the mental protuberance. and that just indicates that the IOML is parallel. You also, again, are checking for air fluid levels. So now we've moved into our mandible series. The first image that we took was our PA projection. You're going to notice that there is some tight collimation here. The mandibular body and the rami are symmetrical on either side. Just says that the head's not rotated in any weird direction. And you're just going to want to be able to make sure that you see the entire mandible. Next is our PA axial, mandibular body and rami. This is usually done to show the medial or lateral displacement of fragments in fractures of the rami. And to make sure the image is good, we're going to look for proper collimation, symmetrical mandibular body and rami on each side. Want to see the condylar processes and the entire mandible. We also don't have an image of our axiolateral lateral projection of the mandible, but that is done to see the ramus, and you want to make sure that the patient's head is in a true lateral. You want to see proper collimation and no elongation or foreshortening of the ramus or body, and that's about it. Moving on, we have our SMV, also known as submento vertical projection. For this image, you want to see that the distance between the lateral border of the skull and the mandible are equal on both sides. The condyles of the mandible anterior to the pars petrosa, and the symphysis extending almost to the anterior border of the face, so that the mandible is not foreshortened.